Welcome to Mission Sunlight. In a world that needs to know Jesus is coming soon, Seventh-day Adventist Christians around the world use many methods to share this good news. Education and healthcare have long been two of the ways utilized to reach beyond the church and into the community. Manila Adventist Medical Center has faithfully been doing this since 1929, when Dr. Horace Hall from Loma Linda arrived in the Philippines and began missionary work among the local population. In those early days, the hospital was known as the Manila Sanitarium and Hospital.
In 1940s, during the Japanese invasion of the Philippines, this hospital served as the Navy hospital for the army of the Japanese forces. And this hospital, before the Japanese went home, this hospital was bombed. It was bombed. And the building was not destroyed because of the bomb. So this hospital was renovated. And at present, only this portion, the suite rooms, were added. In 2003, we changed the name to Manila Adventist Medical Center and Colleges.
The staff at the medical center cares for 65,000 to 70,000 patients annually, as well as operating a 162-bed inpatient care facility. Additionally, in 1993, a college was established as a part of the medical center. Today, it has grown into a tertiary health sciences institution.
The college has about 800 students, and we have 4 courses. We have Bachelor of Science in Nursing, Bachelor of Science in Physical Therapy, Bachelor of Science in Radiology, and Bachelor of Science in Midwifery.
In a hospital setting, the spiritual care of both patients and staff is the ministry of chaplains, who trained specifically for this role of specialized ministry.
Yeah, the chaplaincy department provides spiritual care for the patients. We visit patients and we listen to their feelings, because patients who come here in this hospital are in crisis. They have so many problems, and this sickness they have affects their lives too, as well as their spiritual life. And so chaplains are here to take care of them and provide spiritual support and strengthen their faith.
We are not only focusing on the physical well-being, but also the spiritual, the emotional, and also, of course, the physical well-being of the people. And in our ministry as chaplains, we do a lot on the spiritual approach for the patients, and we support the doctors in their ministry for the physical well-being of the patients, and we encourage cooperation between the doctors and the patients as well. In my personal visits with patients, I always see to it that I can lead them to remember and have faith in Jesus. Sometimes I ask them how is their courage in the Lord, and when I have prayed for them, the patients are very appreciative, and they are sometimes they express their joy of knowing Jesus and be reminded of His love in spite of the sufferings they have.
An important part of a hospital chaplain's training is to complete a course in clinical pastoral education, more commonly known as CPE. This program is supervised training used to develop the skills of chaplains in spiritual care in a multicultural and multi-faith setting. Manila Adventist Medical Center is the first Adventist institution outside of North America to have established a CPE center.
Clinical pastoral education is actually a professional education for ministry. It brings theological students as well as ministers, clergy persons, and even lay persons into a supervised encounter with people in crisis. That's why we use the clinical setting of the hospital. So out of their intense involvement with them, persons in problems and crisis, they develop awareness of themselves, their limitations, their weaknesses that may affect their ministry to other people. And so with the feedbacks of their peers as well as their supervisors, they become aware of themselves and also the needs of the patients they are ministering to. So with the theological reflections on certain specific human situations, then they were able to experience a wide experience in their ministry. So they also develop skills in their relationship, and they also develop facilitating skills as well as interpersonal relationship.
The CPE program at Manila Adventist Medical Center is attracting students from various faith traditions. Dominique Dinea is one of those students. During his training, he has discovered many new things about his role in his chaplaincy ministry.
CPE program, it is a kind of program that will help the candidate to really have these feelings, or to help him to develop his love for the patient, and also in the process you will be able to know yourselves. Well, at first I really had apprehension in taking CPE here because you know, I don't want to feel as if I am a stranger. But this institution, the MAMC, really welcomed me as if I am one of them. I never felt that I am a stranger.
For Dominique, being a chaplain is more than a job. Daily, he sees how patients receive both physical and spiritual healing.
I believe that the patient here in the hospital, they don't only need medical treatment, but they also need somebody who will journey with them in the process of receiving healing from God.
As the CPE program at MAMC has evolved, the chaplaincy staff saw an opportunity to also train hospital employees. They began a program called Supervised Pastoral Education, or SPE.
This helped the employees to develop more their skills in ministry because they are facing patients. So they become aware of themselves, their attitudes, their behaviors that they are not aware before. And so with the help of the feedback of their peers and their supervisors, just like me, then they were able to develop self-awareness and also the needs of other people whom they minister.
This SPE program helped me a lot. I became aware of myself, and then I learned to communicate and minister with the patients, learn to know their feelings and concerns, and the best thing I've learned is the fear of communicating with the patients. That's the number one I've learned, to communicate and minister with them through their pains and struggles in life.
Through the work of the chaplains and the CPE program, relationships with members of other faith groups are being established and strengthened. People who don't know about Seventh-day Adventist or who may have misconceptions have an opportunity to learn more about Adventist lifestyle and beliefs.
People from different denominations begin to come here to have the training. So because MAMC is a member of the Pastoral Care Foundation Incorporated, it's an organization which sets the standards for clinical pastoral education. And so this hospital, our CPE center here, is being known even from other denominational churches. So we are reaching out to them through our relating with them. They can see our hospital here, and they would observe our employees and workers here, and they make friends with them.
The medical center's chaplaincy program isn't the only outreach into the community. Promoting health and well-being of all people through a holistic approach is an important part of patient care and also community outreach.
Our trust is not only curative, but we have the preventive side. So what we do is we have a team that will educate our patients the preventive way of not getting the diseases. Now we have the CHIP program, the preventive program for the heart.
Additionally, the team visits local businesses to offer instruction to their employees.
We send our team, and then they go and lecture, make presentations, and if the company are interested, the management are interested, they ask for our team to go to their place and make a presentation. And we are sharing our message, our lifestyle to the outside world.
As the medical center reaches out to patients, staff, and the community, lives and hearts are changed.
But tell me where I am now, am I almost there? Is that heaven's bright glory I see? Is that Jesus I hear calling out my name? Is that door standing open for me? Is that door standing open for me?
As a hospital within the Seventh-day Adventist Church, I want to share to you that we are true to the mission of the church to continue the healing ministry of Jesus Christ. And to the best of our ability, we are doing what we can as our share to the ministry of Jesus Christ here in this world.
The Gospel Commission is to go into all the world. Through Mission Sunlight, you can see into all the world. Through your 13th Sabbath offering, you can change all the world.
Continuing the ministry of Jesus is what each Christian is called to do. Manila Adventist Medical Center, like Seventh-day Adventist hospitals worldwide, carries this out by offering physical and spiritual healing to the community around them. This quarter, your offering will help Manila's sister hospital, Manado Adventist Hospital in Manado, Sulawesi, Indonesia, needs to enlarge its facility in order to serve the growing needs within the community. The city of Manado is a provincial capital and is located on the island of Sulawesi. Though a visit to the Indonesian region was prohibitive for the Mission Sunlight team at the time of our travel, your 13th Sabbath offering funds will arrive to our brothers and sisters in Indonesia not a moment too soon. Give generously to your local 13th Sabbath offering on Sabbath, June 30th for the Southern Asia Pacific Division. Reporting from the Philippines, this is Mission Sunlight.